Hello, this is Dr. Gay from First Look MRI, and this is a 63-year-old gentleman who fell 1 week ago, has a limited range of motion and pain in the shoulder, and we have an axial image here on the left that shows a tear of the subscapularis tendon. This is the subscapularis muscle in the front. We see the dark band is the tendon, and we see the torn end right here. And the subscapularis tendon should go on to attach over here on the lesser tuberosity of the round humeral head here, or ovoid humeral head. But it is torn from the insertion and retracted all the way back here to the glenoid. And if we look on this view, this is a sagittal view. We see the supraspinatus muscle up top. We see the muscles in back, the infraspinatus and teres minor. And we see this abnormal torn muscle here in the front, the subscapularis. All this area of bright signal or fluid signal is the tear. We see fluid extravasating out from the joint into the soft tissues. And if we go down further, we're going to see one more finding. So this is the glenoid, this cup. And it looks like a round ball, looks like a golf ball, and this looks like a golf tee. This is the glenoid, the golf tee. And we see a little dark tissue along the anterior rim and posterior rim. This is the anterior and posterior labrum. The labrum goes around the rim. And if we go down to the bottom here, we see the labral tissues along the bottom. In the back, they look good. In the middle, they look good. But in the front, there's a defect. This is a deficit where they should see a nice little dark labral fragment, but instead the labral fragment is torn. They have a tear of the anterior capsulolabral complex, the joint capsule that holds the joint there firmly, and also the labrum beneath it. They're both torn, and this little dark band is a piece of that labrum that should be right here. It's moved or rotated forward or displaced forward, and we see it right there in front of the glenoid. Typically, we have a nice, well-defined sheet of joint capsule going across here for the joint capsule. If I move it out of the way, we can see this little band here is part of the joint capsule that's torn and uplifted. And there's that piece of labrum. So we would call this a detached and displaced labral fragment with a ruptured anterior joint capsule and a completely torn or ruptured subscapularis tendon. Thank you very much.